Hello, I'm Dr. Maher Abbas, an American board colon and rectal surgeon currently practicing in Dubai, the United Arab Emirates. I'm also a fellow of the American Society of Colon and Rectal Surgeon. Today we will be speaking about surgical option for anal fistula. Now, a patient often asks me in the office, and I see many patients every week with anal fistula as an expert in this disease management, about what is an anal fistula and what is the best treatment for my anal fistula. Well, anal fistula is basically a tunnel that has two ends. One end is inside the anus itself and another one is on the skin. And it's usually related to an infection or an inflammatory process that causes the fistula. Now, once the patient gets a fistula, it's important to know that there is no medical conservative treatment for anal fistula. Patient may take antibiotic or pain medication or use local cream to try to help with the symptom, but the only effective way of getting rid of fistula is a surgical operation or a procedure. In general, the majority of patients prefer to get it treated rather than live with the symptom for a long time. It's important to know that a fistula is not something dangerous, but it's more of a nuisance that negatively impacts the quality of life. In general, the treatment of anal fistula can be very tricky. Unlike other proctologic disorders such as hemorrhoid, fissure, or warts, anal fistula require expert care because of the complexity of an anal fistula. Why is an anal fistula a complex condition to treat? The first thing is anal fistula occur in a very dirty area of the body that sees billions of bacteria every day from stool. Furthermore, an anal fistula usually is an infection that involves the anal sphincter muscle, which is responsible for maintaining continence in people. So it's very important that when a surgeon tries to treat anal fistula is that they achieve the highest success rate for the patient, and also they minimize any risk for the patient during the recovery, but also long-term maintaining good function for the patient. Now, in general, we divide the treatment for anal fistula surgery in either sphincter preserving repairs type of options, or under the category of fistula removal, where we actually, in one case, we repair the fistula, and in another one where we remove the fistula from the body. And there are merits to both of these category of treatment. It's very important that the surgeon knows all the various treatment for anal fistula and chooses the appropriate treatment for the appropriate patient. Now, the simplest treatment for anal fistula is to put a thread, something we call a draining seton, which is a thread we put from inside of the fistula to the outside to allow the fistula to drain, and that's what we call a draining seton. Often a draining seton is used as a temporary measure just to control the situation, to clean the area before we do something definitive for the fistula, and typically we defer the treatment after seton placement for about 2 to 3 months before we do the next step. Sometime in between the initial placement of the seton and the next step, the surgeon may need to do an MRI of the pelvis to make sure that everything is under control before a definitive fistula repair is done. Now, a patient often come to my office with one operation in mind, which is a laser. And it seems like there's a lot of laser being done nowadays from a marketing perspective to attract patients. But from a medical perspective, laser is an option for some patients, typically for deep or high fistula, but it's not a good option for a low-lying fistula. What do I mean by that? A low-lying fistula is a fistula that does not involve a lot of muscle and typically can be treated successfully by a variety of methods, and a high complex fistula is one that is deeper inside the anus and involve a lot of muscle. So I'm not a big proponent of laser, especially when it's used indiscriminately, because it can cause a lot of burning, a lot of problem, and I treat every week in my office patients who have received laser surgery and the situation have gotten worse for them because the laser had burned deeper hole and turned something simple into something more complicated. So even though a laser is one of the therapy that we have at our disposal, it should not be the only therapy, and it should be selected for the proper patient only. So in terms of sphincter preserving kind of repair, we have a technique we call the lift procedure, where we basically divide the fistula in between the two muscle and tile. We have endorectal advancement flap, which are operation where we close the inside of the fistula by sliding a little bit of the wall of the rectum and then sealing over the opening on the inside with fresh tissue that is not infected. That's an endorectal advancement flap. We have a procedure that obliterate or try to scar the fistula tract, such as laser or videoscopic surgical operation. We have in the past, and patient may read on the internet about injectable or plugs for the anal fistula. These in general have not been very effective, and all the long-term studies have shown a very low success rate. Now in terms of fistula removal, this is where we remove the fistula, and this is a very good treatment for the low fistulas, where we either completely divide the fistula or we core out the fistula, a procedure called fistulotomy or fistulectomy. The fistulotomy is where we divide and clean the fistula and let the body heal it. The fistulectomy is where we go and we core out the fistula and then we close the area of the muscle. And these are very good options with very high success rate for a lot of patients. And the reason why it works for a lot of patients is most of the fistulas in general tend to be low and are amenable to these last two techniques I mentioned, with very high success rate and very minimal risk to the patient. But we do reserve the other technique for deeper and more complicated type of fistula. And finally, as I alluded to, a seton, the most common seton we use is a draining seton, which we typically put for about 2 months before we do the next operation, unless the patient has inflammatory bowel disease, in which case they may require the seton for a longer period of time. Now, the most important thing in the treatment of anal fistula is that a patient needs to do their homework very well and choose a very good surgeon who has a lot of experience in the treatment for anal fistula in order to maximize the chances of healing and getting rid of the fistula. And the reason I mention this is from experience. I see in my office every week many patients who've been treated numerous times, anywhere from 2 to 3 up to a dozen times, all with failed surgery that didn't work, all done by a practitioner who don't have a very good understanding of how to treat anal fistula.